Elbow pain is something nearly everyone experiences at some point. It's one of the top reasons people see a doctor or physical therapist. But while the symptom is common, the causes can be surprisingly complex. From overuse to sudden injuries, from inflammation to nerve problems, understanding where the pain is and how it behaves can help us figure out what's really going on. So today, we're breaking down the main causes of elbow pain, how we diagnose it, and the best ways to treat it. This video is for educational purposes only. It's not medical advice. Always talk to a licensed healthcare provider if you're dealing with pain or have questions about a diagnosis. I'm Dr. Rezaian, a specialist in joint and muscle conditions, and I'm here to walk you through what your elbow might be trying to tell you. Let's start with the location of the pain. Different areas of the elbow often point to different causes. If your pain is on the outer side of the elbow, it's usually due to tennis elbow. This happens when the tendons that help extend your wrist get overworked, especially one called the wrist extensor. You'll often feel pain when gripping things or lifting. There's also a nerve condition called radial nerve compression. It can feel like a deep ache in the forearm and can easily be mistaken for tennis elbow. But the treatment is different, so getting the diagnosis right matters. Pain on the inner side of the elbow is often called golfer's elbow. It involves the tendons that help you bend your wrist. This type of pain shows up with lifting, gripping, or wrist flexing. In athletes who throw a lot, like baseball pitchers, we watch for injuries to the elbow's inner ligament. This band of tissue helps keep the joint stable. Too much stress can lead to small tears and pain during throwing or overhead motion. There's also a nerve that runs near the inner elbow that can get pinched. When this happens, it causes tingling or numbness in the ring and pinky fingers. You might notice this more at night or when your elbow is bent for a while. If the pain is at the back of the elbow, we think about things like inflammation in the fluid sac or triceps tendon strain. These conditions cause pain when pushing or leaning back on your arm. Pain in the front of the elbow may mean a strained or torn biceps tendon. This can happen suddenly, especially when lifting something heavy, and may cause swelling or bruising. After figuring out where it hurts, the next step is to figure out why it hurts. We always start with your story. When did it start? What makes it better or worse? Was there an injury? Do you have any other symptoms like fever or tiredness? Next, we do a physical exam with targeted tests. Here are some examples. Tennis elbow tests. You stretch or resist your wrist, and if it causes pain on the outer elbow, we're likely dealing with tennis elbow. Golfer's elbow test. Same idea, but using wrist flexion to check for inner elbow pain. Ligament test. We gently stress the elbow to check for looseness or pain that could point to a torn ligament. Nerve tap test. We tap over the nerve near the elbow to see if it triggers tingling in the fingers. Biceps check. We try to hook a finger under the biceps tendon. If it's not there, it may be torn. If we still need more information, imaging helps. X-rays are good for checking bones and joint space. Ultrasound can show swelling or tendon damage in real time. MRI scans give a closer look at soft tissues like ligaments and nerves. CT scans are helpful when we suspect complex bone injuries. If we suspect a systemic illness, like arthritis or a crystal buildup, we may also order blood tests or even remove some fluid from the joint for analysis. Now let's talk about treatment. The best news? Most elbow pain can be treated without surgery. We start with rest and activity changes, ice and anti-inflammatory medicine, physical therapy with targeted exercises, especially for building strength and improving posture, bracing, like straps for tennis elbow or splints for nerve compression. Sometimes, steroid injections can reduce inflammation, though we use them with caution. If the issue is related to a broader condition like rheumatoid arthritis or gout, medications may help calm the immune system or reduce uric acid buildup. Surgery is only needed if other treatments haven't helped after a few months. Procedures might involve repairing torn tendons, fixing a loose ligament, relieving nerve pressure, or removing inflamed tissue. So here are your key takeaways. Pinpointing where the pain is helps identify the cause. A good physical exam and the right tests can confirm the diagnosis. Most cases improve with simple, non-surgical treatment. If your elbow is bothering you, don't ignore it. Getting a clear diagnosis and starting the right treatment can make all the difference. Thanks for watching. Be sure to like, subscribe, and stay tuned for more helpful insights on joint and muscle health.